Hi, I'm Virginia Willing, and I'm in Dr. Eric Osman's class, Healthcare Informatics, and this is my project on video project on what I've been reviewing and studying. I am going to talk about how to transition to computerized charting and why we want to do that. In healthcare, it's so important to capture information that can be used to help patients in the future, and also it is important to document and have a way to look at the information that you have recorded. This presentation is going to tell you how you're going to make a transition to computerized charting. To begin with, the way we've always documented in nursing has been paper charting, and that's the way you recorded the medications you gave and the way doctors wrote orders and the way the orders were transcribed. Well, that's kind of become it's not realistic anymore, and we need to be more current with technology. We have to make sure that healthcare is in the ranks of this process, and so we can have improvements in providing safe, effective, and efficient care for our patients. In the book Healthcare Informatics, written by Stephen Kutyba, I guess that's how you say it, he talked about how we could implement a computer information system and how it would be beneficial to those that were given the care and those that were receiving the care. Doctors have a history of writing orders that you can't interpret. So for them to enter orders in the computer, it makes it much more efficient. The orders can be easily read and acknowledged, and you don't need an interpreter to figure out what they were trying to write. A lot of people don't like change, and when you have to change over from a paper charting system to a computerized system, staff can be resistant. A lot of that has to do with fear, because people like me, an older generation, we're not familiar with technology, and it kind of frightens us. The younger generation doesn't have a problem because they've always been involved in media and uses of media. The way that you can ease into changing methods is to change the culture by having classes for people to understand why you're going to transition to this process and why it's important to transition to the process, and also including that it's going to be expected they do that. There's no two ways to chart once you transition over to a computer charting system. It has to be all or none, and those that can't do it or don't want to do it or just refuse, they may have to find somewhere else to work because it's going to be expected that they participate. It's hard to change. Nobody wants to change. But change involves growth, and growth involves change. For a healthcare industry or a business to remain successful, they have to come into the 20th century. They have to use or make the changes necessary to keep with the modern world and be a part of the process. There are many benefits to implementing a computer information system. One, it leads to improved patient outcomes. It increases the safety of patients, cuts down on potential medication errors, and allows the nurse to spend more time at the bedside. And what is more important than spending more time with your patients? When you're able to spend more time with your patients, you help to facilitate trust with them and allows them to make a connection with you, and if they have a connection, then they're going to be more likely to listen to, comprehend, and follow recommendations for their plan for care. It doesn't automatically happen to transition to computer charting. You can't just wave your magic wand and everything be instantly improved and incorporated. You have to follow some processes and steps. You have to find the right computer system for the right business or healthcare company. To begin this process, we have to have management and all the staff that's going to be there to review the systems, their costs, and the challenges that are associated with implementing a system. And this central committee will make the selection of the system based on the needs of the company and the cost. All the details associated with installing a system are handled by those chosen to complete the different tasks that have to be completed to finish the process. Once the system has been chosen and installed, there has to be education of staff. And as I was referring to Mr. Kudiba, excuse me, physicians need to be trained first. By making the physicians feel they're an important part of the process, and it helps them to learn to use the system first, and lets them have an input into the way order sets are developed. It makes them feel that they are important and necessary. Physicians that buy into these processes are usually very supportive of that process. Training is important to developing the staff's ability to understand and use the system. You don't want to train folks out too far, because if it's too far out from implementation and go live, it makes it easier for them to forget. And once the go live date has been set and implemented, the educators and staff, that we have staff trained as super users, will be on hand to give support. There will be IT professionals available to address issues and concerns that will arise, because nothing is perfect. And initially there's going to be people available around the clock to help staff. But as staff becomes more comfortable with the computer system, there'll be less and less interventions required. Once you have the implementation of the system, the staff has been trained, and the staff are learning to use the system, there's going to be, it's not an end-all. There's going to be problems that come up, and they have to be directed to IT personnel to address the issues. It takes everybody to make this process a success. It takes the people that put the system in, the nurses and physicians and support staff that participate, and everybody, even radiology, patient physical therapy, because everybody has to buy in and be able to utilize the process to make it a success. We have to follow workflow processes to save time, and by saving time we increase productivity. And when you increase productivity, you save money, because it cuts down on wasting time. And the computer system makes it easier to chart and stuff, and instead of having to do everything by hand. If a patient has one example of this is if a patient has their armband scanned and then the vital signs are typed in or put in the computer, by touching a button they can transport that information to the patient's chart, and it'll be there to look at immediately. And this is a wireless technology, and Hogan and Rutledge explained about that in 2013. Computerized information systems, they are not meant to intimidate people that aren't comfortable with them. It's an opportunity to become part of a healthcare that leads to patients getting the best care they deserve and increasing the safety of their care. Everybody deserves to receive the benefits of computerized charting, and it just makes it safer for patients and makes for more accurate documentation. When everything is said and done, and the computer information system implementation process and the staff participate and use the system, another very important aspect of the computer information system is for analytics to be able to extract data. And extracting the data is an important part to provide providers a way to use recommendations that are proven to treat their patients more effectively. Let's see. Informatics and data mining are important to the world of healthcare. Having analytics available to establish algorithms that can determine if there are connections between data is necessary to increase potential future issues in healthcare. And it's funny how things that don't seem to be connected at all, like like Kudiba explained, there was through analytics extraction of data, there was a swine flu epidemic predicted 18 days before the World Health Organization even had sent out an alert. Computer information systems are not the do-all, end-all, but they do provide an excellent resource for data that can be mined that can lead to improvement in a patient's health. There is no better way to make use of technological advances than to use them to make healthcare better and provide the opportunity for patients to get the best care they can receive because of that advance in technology. we're really lucky to live in this day and age, because the diagnoses that were received 30, 40 years ago, such as cancer, were automatically a death sentence. But now there are ways for people to live with cancer as a condition and not as something that's going to kill them. Also, with managing long-term health issues like diabetes and blood pressure, it can help people to live with those diseases and be managed and not automatically die. Thank you.